I'm Dr. Amy Schreibman. I'm a nurse practitioner and a doctor of nursing practice. Welcome to Medical Minutes. Today we're going to talk about rheumatoid arthritis. Rheumatoid arthritis, also known as RA, is an autoimmune disease that mainly attacks the synovial tissue within the joints. This is not the same as osteoarthritis, which is when cartilage breaks down, causing the bones within the joint to rub together. Autoimmune diseases occur when the body's immune system makes its own tissue for foreign invaders, such as bacteria or viruses. The confused immune system develops antibodies to seek out and destroy the invaders in the synovium. RA is a systemic disease, which means it can affect the whole body. It can attack organs such as the heart, the lungs, or other tissue like muscles, cartilage, and ligaments. RA causes chronic swelling and pain that is sometimes severe, and it can cause permanent damage. At the onset of RA, you might notice that small joints like your fingers and toes are warm, stiff, or swollen. These symptoms might come and go, and you may think it's nothing. RA flare-ups can last just a few days or a few weeks before they disappear again. Eventually, RA will affect the larger joints like hips, shoulders, and knees, and the period of remission will shorten. RA may damage joints within 3 to 6 months of onset, and 60% of people with inadequately treated RA are unable to work 10 years after onset. Other symptoms associated with RA include fatigue, low-grade fevers, pain and stiffness longer than 30 minutes in the morning or after sitting, anemia, weight loss, rheumatoid nodules, or firm lumps beneath the skin, primarily in the hands, elbows, or ankles. RA can be hard to diagnose because the types of severity of symptoms vary from person to person. They're also similar to symptoms of other types of arthritis, which make misdiagnosis possible. The cause of RA is unknown, but a number of risk factors could contribute. Things like hereditary, environment, lifestyle, like smoking or alcohol use, can be a problem. Out of every 100,000 people, 41 are diagnosed with RA every year. About 1.3 million Americans suffer from RA. Women are about 2 to 3 times more likely to get RA than men, and hormones in both genders may play a role in either preventing or triggering it. RA increases the risk of heart disease, stroke, because it can attack the pericardium, which is the lining of the heart, and it causes inflammation throughout the body. Risk of heart attack is 60% higher 1 year after being diagnosed with RA than it is without the disease. People with RA may avoid exercise because of joint pain, risking weight gain and placing extra strain on the heart. People with RA are twice as likely to suffer from depression, which may be due to decreased mobility and pain. The damage RA can do isn't limited to the joints. Again, the disease also can affect your heart, your lungs, your vascular system, your eyes, your skin, and blood. Infections may be responsible for 1/4 of deaths in people with RA. Although there is no cure for RA, there are many different treatment options that can successfully relieve symptoms and prevent long-term joint damage. Healthcare providers may prescribe medication, lifestyle changes, or a combination of both, with the goal of achieving a state of remission. There are currently 4 different drug classes used for the treatment of RA. NSAIDs, which are non-steroidal anti-inflammatory drugs, and this is the mildest class of medications. Corticosteroids, which are more powerful and quickly decrease inflammation, and they're ideally used for short term. Disease-modifying anti-rheumatic drugs, also known as DMARDs, are the most standard RA treatment, and they work to slow down the progression of RA, but may cause moderate to severe side effects. Biological response modifiers, they're called biological DMARDs, are often used in conjunction with DMARDs to work to modify immune systems that have trouble responding to the DMARDs themselves. A recent approach for the treatment of RA suggests the use of aggressive treatment in the early stages of onset of RA in order to prevent it from graduating to a more serious and long-lasting state. Living with RA can be not only physically taxing, but emotionally taxing as well. It's suggested for people with RA to find a balance between rest and exercise and to keep their inflammation down while continuing to maintain strength and flexibility. Your healthcare provider will generally recommend certain exercises, beginning with stretching and then working up to strength training, aerobic exercise, water therapy, and Tai Chi. Experimenting with dietary changes such as elimination diets can help with RA. There is some scientific evidence correlating diet and RA treatment, such as decreasing sugar, eliminating gluten, and increasing omega-3s. There are also many herbal remedies used for the treatment of RA, but scientific research has been a little controversial. Because many people living with RA often experience chronic pain, it is very beneficial to learn stress management and relaxation techniques, such as guided meditation, mindfulness, breathing exercises, biofeedback, journaling, and other holistic coping modalities. RA doesn't have a cure at this time, but many effective treatments have been developed over the last 30 years, but none are a cure. Instead, they aim to lower inflammation and pain and prevent joint damage and slow the progression and damage of the disease. If you have any questions or comments on what we discussed today, or if you have a topic you'd like to learn about, please leave them in the comments section below and we'll get back to you. Remember to follow us on Facebook and on our website, The Boca Voice. I'm Dr. Amy Schreiben, and I'll see you next time on Medical Minutes.